effect on your caregiver. Now, the way that it could influence, interestingly, so let's say you're really, a difficult kid because you have ADHD. It's possible that that could influence, and actually research has shown that it does influence the quality of your relationship with a parent. Parents are people, as we all know who are listening, because we're all parents. So if a kid does have ADHD, they're more difficult to deal with. The parent may need to set more boundaries. The parent may yell more, and that's not ideal, but life is not ideal. So we're talking about the world that is, not the world that should be, right? And so in that case, then yes, it will impact attachment style if the caregiver, there's so many other variables, right? So like if the caregiver themselves has ADHD, right, they could either get along with you better, or you could be at loggerheads. Like there's just all this goodness of fit between parent and child, and people don't ever really talk about that. They talk about it a bit in literature, of course, but like in common parlance, we're really not allowed, societally to be like, oh, some parents and kids are just a better fit than other parents and kids. But some people would be really good parenting a kid with ADHD. Some people aren't, and so if it's like a depressed mother and a kid with hyperactive ADHD, she's going to be subconsciously trying to get away from that kid a lot because he's just overwhelming her so much. And so then that child with ADHD would likely have a higher risk of having a preoccupied or an avoidant attachment style based upon how the mother interacts with him, which is